further ado, I would like to introduce our guest speaker today. Erin Harris is a licensed independent social worker with supervision designation and a clinical social work manager at The Ohio State University Niswonger Center. And she will be presenting today using Charting the Life course to inform treatment planning and navigation. Erin, welcome and thank you.
Hello, everyone. I'm going to go ahead and pull up my slides. And I am not the only one presenting today. My wonderful colleague, Michael Valentino, is going to be joining me to talk a little bit more about how we use Charting the Life course. So here's a little bit about Michael. Mike, you're here. I know I saw you, so
I'm here.
Great. Okay. Real quick, before we jump into things, I'm gonna throw up a poll because I would love to see if anyone or everyone is familiar with Charting the Life course, because that's gonna kind of help us know how much time to spend on different things and just get a sense of where everybody is at. All right. All right, so we got a little bit of everything, that's wonderful. Okay, I think that will help our discussions be even more wonderful. So great. All right. I will end that poll just for you guys if anybody's interested. Here are the results, a little bit of everything. Okay. So let's jump in and get started. Okay, so a lot of you probably already know me. I'm Erin. I'm a social worker. I work at the Niswonger Center, wear many hats, do lots of different things, a little bit of service, a little bit of assessment, a little bit of treatment, a little bit of leadership roles, things like that. Mike, do you want to do a quick intro to yourself so everybody knows who you are?
Yeah, my name is Mike Valentino. I am the program manager of Aspirations, which is a social skills group for people with autism, ages 13 to 30. And I do a little bit of clinical counseling under the tutelage of Erin at the Niswonger Center as well.
Yeah, okay. And both Mike and I are Charting the Life course ambassadors, which is why we know a little bit more about this stuff than other people. I would say we are by no means experts in Charting the Life course, but we know a little bit of what we're doing. All right, so Charting the Life course was developed by Life Course Tools, Nexus Life Course Tools, housed at the University of Missouri, Kansas City. And they've done a lot of great research and stuff on our course. Mike, when you're not talking, can you mute, please?
Yes, I'm sorry.
That's okay. We're all presenting from various places today, so sorry for the extra noises. All right, so our goals for our quick review of Charting the Life course is to help you all identify the overall, what is Charting the Life course, the resources, and how to potentially use these tools and overall process with folks with IDD and mental health in treatment and linkage. So specifically that treatment and treatment planning area. We're going to understand how to integrate in participant cultural variables in the process and identify the framework and how it works. All right. Okay. So, sorry. Here are the guiding principles. I am not going to go over all of these because we just don't have time. But take a look. So we're focused on all people. We're going to think about family systems and cycles. We're thinking about across the lifespan and how we might use this in different stages of life to really help with outcomes. We're going to take a look at life domains. So not just across the life course, like different stages in our lives, but also like different stages within our life. We're probably not going to talk about the 3 buckets, but we'll give you information to learn more after this. We are going to spend some time talking about the integrated supports and the integrated STAR. All right, moving on. Okay, so this is going to be my like brief and basic overview of charting the life course framework. So the goal of charting the life course is really looking at the person, right? So it is person-centered. But then we know people have families, right? So it's not just person-centered, but also family-centered. All right, the next layer in thinking about charting the life course is looking at all different life domains. So in life, we have like our daily life, our employment, we have our social and spirituality part of our life. Safety and security is a huge part of our life. Community living is, I would say, a goal for most. I know we may have a few people who do live in more segregated spaces, but I think everybody's goal is to move towards community living. We all want healthy living, and we all want to think about citizenship and advocacy. All right, and then these are when I talked about those 3 buckets, these are the 3 buckets. We are thinking about connecting and networking, goods and services, discovery and navigation. And again, we'll kind of like, you'll see how some of that fits in a little bit here. And then our integrated supports. So we're going to start at the top here. So relationship-based supports, eligibility-specific supports, eligibility-specific supports. Those are going to be like your Board of BD services, your SSI, your SSDI, that kind of stuff. Then community-based services, pretty self-explanatory, technology. And then now I really can't remember this last one in the top corner, light blue. Can you guys see it, or is my bar in the way here at the top?
Strengths and assets.
Thank you. Probably the most important one. What are our personal strengths and our personal assets that we might have, and how might those be a useful tool? All right. And then our trajectory, our life trajectory. So, charting the life course can be used, the framework and the tools can be used across the lifespan. One of the important things, and I think something that we might talk about today, is how can these tools be helpful in planning and treatment during transitions? So literally from, early childhood all the way up to, graduating from high school, getting a job, moving into older age. All right. So, Mike, I'm going to let you take over and maybe talk a little bit about how specifically Aspirations has used Charting the Life course and some of the tools. And then we'll kind of dig into some of these tools so you guys can really start to think about applying the very brief, quick framework that I just explained.
All right, so in Aspirations, what we do, there is something called a 1-page person-centered description, and Aaron, it'll be further down in the slide. But what it does is it kind of changes the language. It's a different way to have conversations than your typical 1-page plan. So what it covers is like, what are the best supports, goals, qualities, but what also don't you want? What doesn't the individual want in their life? So through this, the idea is to use this tool to get what is the best life. What are some of the ways to achieve like self-determination or integration, inclusion in all facets of life. So it doesn't have to be specific to overall life. It could be something as, getting a job or something like that. So it can be tailored to specific needs. So what we do is we have the parents fill out a person-centered description about their child in the group. And then we also have the individual in the group complete one. And then they compare them later to see how it goes. And the parents, usually the participants are not really excited about doing it, but the parents they cannot wait, and many times, to see what the child wrote. When we go a little bit further down, we'll see the plan, and there's some examples of it too. There are some other tools. Here we go, right here. I'm sorry, go ahead, Aaron. So this here, this is Barry or Ben. So if you could see up
Sorry.
there, that's okay. So Barry and Ben. So this is Barry. So this is a way for an easier way to put it for him. So maybe he might have a challenging time of describing his strengths. So the way that it's worded is, what do others like and admire about me? So it might be easier when it's framed that way, it's easier for Barry to come up with some of these things. And he's a great dancer. And then the next one, let's see here. So what is important? So like family is important. He has a son who lives in New Zealand. His appearance, he likes to look sharp. He likes to garden. And then how to best support me. So he responds better to male caregivers. When he's frightened and confused, he can become agitated. Supporting him, you could kind of tell him what to do and help him while supporting his needs. And if he's distressed, let his in-care nurse know. And then he should always have a drink nearby. So it kind of gives like a roadmap to what Barry wants and what gives him the good life.
And so I think one of the things about the one-page person-centered description and how it can be used in treatment planning for me, when I'm doing individual counseling, one of the things that can be really helpful is using this, one, as a visual, but two, as a way to get to know my patient, my client, the student I'm working with. So thinking about, building rapport, learning more about them in a way that's not just like boring question answer kind of thing. And I think that's one of the main things in aspirations that we like about it with our participants, is because not only are they trying to maybe build some insight about themselves, but it's also helpful from the facilitator and clinician standpoint to kind of really learn about that person from their perspective. And in aspirations, sometimes from the parent perspective, and how do those two things differ versus me as a clinician, getting, a million documents from assessments, from psychologists, from, whoever, other providers, written in maybe, very, medical jargon kind of language that the individual didn't have any impact on me learning that information. So it's a way for me as a clinician to learn information directed by the young adult that I'm working with.
Right. If you see the way the questions are framed on the person-centered plan, it's what is people like and admire about me, to where it needs, it's best if it's Barry's words. Like your traditional ISP or IEP is the provider or the professional's description of Barry, but this is his own words, which again, as Aaron said, makes it easier to build rapport and to truly know how to best support Barry.
So we're gonna move forward and talk about the trajectory and the vision tool. So the example that we have here, a transition specialist in a pediatric autism center supporting youth ages 15 to 22, shares that she uses Charting the Life Course framework to facilitate conversations with youth and their families. Favorite tool is Trajectory, helping them envision their future and their goals as they leave a pediatric and education system into adult systems. So again, that transition. Usually, I would say not just in this setting, but a lot of our folks have a limited vision, and looks forward to helping them explore that in all domains of their life. Supporting them to see employment in their good life instead of seeing getting a job as the end or just the vision. Then the vision tool can help them think about life a little bit more broadly. So I'm going to skip forward a little bit and see another example of that. All right. So we got Ben. Mike, did you want to share a little bit about Ben, or you want me to share a little bit about Ben?
I can do it.
Go for it.
What happens here with Ben's trajectory is the arrow going up will show obviously the things in his life that is good, a good life vision. But the nice thing about this tool is underneath the arrow trajectory is what he doesn't want in his life, which can be very helpful to know. So, you know, you see like friends, obviously he's getting a tattoo there. Numerous different community supports there, fire station, church, doing good food, beer, and being activity and healthy. But, you know, the things that he don't want, you know, is the poor health and guardian. So that's something I think is very beneficial to know, that, you know, he does not want a guardian. And then he doesn't like to be isolated or in a group home or to be treated differently. So as he goes through life, these are the best ways for him to achieve these goals.
Yeah. And again, a really good way, I mean, Charting the Life Course in general, the framework, very person-centered, very focused on how do we get to a good life. And I think when we get into thinking about mental health and mental health treatment, and all of the other, you know, things that encompass, you know, intellectual and developmental disability folks and treatment or supports that they receive, a lot of times as a clinician or as a provider, things get a little siloed and you get really focused in. So using tools like this is really going to help, and using this framework is going to help kind of bring it all together and think from that, you know, larger life trajectory. What are our big goals, and helping us narrow down to like, okay, how are we going to get to those big goals? And then that's then maybe where, you know, you as a mental health clinician are going to be like, okay, so our big goal is, you know, we want our own job. We want to be healthy and fit. And then as we're narrowing that down, okay, well, here are where, you know, our mental health gets in the way to being healthy and fit, and you know, our depression makes us have low motivation. And okay, so here now we're going to really focus in on that. So kind of thinking about this tool as like big picture to then narrow down. I have some resources to share here, but there's a couple different worksheets that take kind of this bigger model that you see on this page, and even adds in some other places here. I don't know if you can see my mouse, but on that arrow up, to break down what has worked in the past to get you to your good life, what has been some barriers in the past that have maybe led you more towards the things you don't want in your life. And then another section to start future planning and thinking about, okay, what are things that are going to, in the future, going to help me get to my good life? And what are things in the future that maybe I need to be proactive or avoid, or that might take me towards things that I don't want in my life. I'm just going to do a time check. Okay, we've got about a couple minutes left here.
And
Let's,
real quick,
ahead.
Aaron, one of the things that's important to know, like about these tools, is that they were all created with the input of people with IDD. So
Yes.
I think that's with the ease of use and things like that is due to their input. So
Okay, and I'm gonna skip over this part, so just kind of again describing what are our life domains, but I want to make sure we get to the integrated support star because I think that's going to be something that will be helpful for our case discussion today. So this is the integrated support star. The goal of the integrated support star is that integrated piece. And we're thinking about not just the person, but also the family and the community, and where do all of those supports fit in with those places. So if you, the little logo down in the bottom left-hand corner, again, it's kind of like pulling it all together and thinking about, again, our skills, our assets, what do people like about me, our relationships, our family. I'm actually gonna keep moving forward because I think we go through. Then you can just actually see what these things say. Mike, I'll take the first couple and then you can take the second couple.
okay.
So we got personal strengths and assets, our strengths, things people like about me, our asset, our skills. A lot of this stuff is going to be things that maybe have been identified in using the one-page person-centered description. Then we're thinking about how are our relationships, how can those things be a support to me in my life, and specifically identifying these people in our lives, because sometimes, I mean, we might not think about it. We might not realize this friend that I see, you know, once a week at book club at the coffee shop, how might that person be a support to me? And really thinking through some of these things. Then we've got technology. I think as providers and clinicians, this is probably one that we do think about pretty regularly. What are the physical things that are going to assist us in our lives? Mike, take over.
All right, so with the community resources, you know, those are important too with businesses, and you know, obviously faith is important. I think part of the thing with the community resources is you know, you want to look past, not just be stuck in the government resources. So finding out, you know, what else is available to you in the community, and not just, you know, from the county board or other places like that. So I think that's important when you look through the community resources of just don't be one track mind. So yeah, the eligibility specific supports, look, you know, that's its own separate place on the star here is, you know, all right, what can I get from, you know, the eligibility area that I'm entitled to versus what I can, you know, use as a community resource. So, you know, the disability specific will be, you know, education, whatnot, you know, versus individual specific.
All right, and in an effort to get us on time here, which I'm already over time, I know that, sorry. Here's another worksheet. So here's the deal. There are like a million different worksheets and tools and things that are on the website that you guys can access, anybody can access. But just kind of an overview and ways to think about how can we use these tools and this idea of person-centered life trajectory, very like overarching things to then narrow down like I talked about. All right, so I'm going to stop talking and let you guys ask questions. So
Thank you,
either
Aaron.
yes.
Thank you, Aaron and Michael, for scratching the surface. Obviously, there's a lot of information here. I see the websites up. So that would be helpful if you want to share in the chat while everyone is thinking about questions they might have. You could share a link in the chat for everyone to get quick access to this tool. I appreciate the visual nature of it, and would invite anyone who has a question to raise their hand or type that in the chat. We'll have time for a question or two. Great, you can see that in the chat, lifecoursetools.com to get access to these templates. While we're waiting for other questions, one that came to mind for me, Aaron and Michael, is what is an ideal situation or setting in which this planning tool is implemented?
Honestly, any setting.
Exciting.
It's a lot of the schools are starting to implement in IEPs. We've got on the county board side, ISPs are moving in the direction of using the Charting the Life Course framework and tools. But kind of like, so the one example that we gave of the transition was a clinician at the Center for Autism Spectrum Disorders at Nationwide Children's. So I know in that individual clinical setting, they're using it a lot. I use it a lot in, psychotherapy. We use it a little bit in our assessments too, as well. At the Nightsonger Center for our Transition Age Clinic as a way to provide feedback to families and support them to receive that feedback, and help them figure out, when you get an assessment feedback, you get a lot of information, and we have a tendency to use these to help them really think through, where do I start? What are my goals? What's a priority right now?
Excellent. Andrea.
Yeah, thanks. I have a comment and then I have a question. Thank you for presenting this. I think as a clinician and thinking from the therapy lens, my mind was blown when I saw lots of these tools, because they're such effective ways to get at things that I think often take weeks and weeks to get to with someone, but are so important. And I think, Michael, the fact you highlighted that they're developed with people with IDD, that means it's in a format that they're already comfortable with. So especially therapists and other service providers can know, they pull out these tools and really know they're done in clear language already, is just such a cool thing. My question is, I'm wondering about if they've been looked at, or if you've had any feedback when we're thinking about different culturally diverse groups and how they're used in different races, ethnicities, etc.
I don't
So-
know, I'm sorry, I don't know how much it's been used, but the framework is, it's for all people. So, the idea behind it is, you could use it for something as simple as you want to lose some weight, or, so there's a lot to be tapped into there. I don't know how much we're getting out into those communities and showing it, which would, I think, be very beneficial. I don't have exact numbers.
Yeah, I do believe that we have materials available in other languages.
Mhm.
I don't know how many languages, but if you check out the Life Course Tools website, I also included FRNO's website, so Family Resource Network of Ohio, because they'll do a lot of training on using Charting the Life Course tools. So that's where you're going to get a little bit more in depth than just our surface level overview here. But like Mike said, it's very person centered, and it's so person centered that you have to all of those areas of life, you have to really consider cultural considerations, right? And so I think it kind of sets itself up for some natural conversations around culture that maybe you might not otherwise think of. Especially again in treatment planning, we have a tendency, and I know I do this all the time, a tendency to not get stuck on, but really focus in on, okay, you're here for anxiety treatment. You're here for skill building. And so we're very focused around that stuff, that we don't think about all of the other stuff naturally in that clinical setting or that treatment setting. And so by taking that step back and really looking at the whole person and making sure that you're recognizing all those other areas of life and how that fits into that treatment, kind of naturally sets you up for making sure that you're checking in on other cultural considerations.
Thank you.
Thanks again, Aaron and Michael, for this presentation on this really comprehensive conceptual framework and graphic organizer and tool that, as you mentioned, can be used from IEP meetings for transition-aged youth into clinical settings. Really appreciate that. If anyone has additional questions as they pop up or as you're exploring the website, please feel free to put those in our chat, and we save those and we can forward that on to our team here to get you some answers. At this time, I'd like to transition us into our case presentation today, which will be presented by Dr. Emily